Hello, everyone. Thank you for joining us today. We're here with Gary Williams. He is our Associate State Director for AARP for Community Outreach. Thank you, Gary, for joining us today. He is presenting Prepare to Care, a Caregiver Resource Guide.
Thank you, Denise. It's a pleasure to be here. I truly appreciate the opportunity to be a part of this important exchange of information. The subject matter, preparing to care, is very, very dear to me in my professional as well as personal life. We are at AARP very focused on providing resources and programming that will allow individuals to live prosperous lives. So let me know where I can help as an AARP member, as an employee of AARP. So I hope you enjoyed this presentation. What I'd like to do today is to talk a little bit about Prepare to Care. As I said, it's an honor to be a part of the programming today. On my part, I'd like to express a regard from our state director, Joseph Sanchez. Joseph, some of you may have seen the opening remarks this morning. Joseph was a part of that, and Joseph has been instrumental in allowing me to be here and participate in this CARE conference today. So thank you again for the opportunity, Joseph. And thank you to Denise Paras. She has been just great with helping me prepare for my presentation, and everyone there at the Alzheimer's Association are wonderful, and I really appreciate their help as well. Next slide, please, Denise. I'd like to start off by identifying for you why it is important for us to talk about care and services that are provided by caregivers. I'll do so by talking about an individual who has invested a lot of time, energy, and resources in making sure that individuals who are in caregiving roles have the proper tools and resources to do well by their friends, their family, and specifically their loved one. Rosalind Carter was a former First Lady. She was married to Jimmy Carter, and she is now currently working with the Caregiving Institute, the Institute for Caregiving. And she once made a statement that reads as follows: there are 4 kinds of people in the world: those who have been caregivers, those who currently are caregivers, those who are will be caregivers, and also those who will need caregivers. That particular statement resonates with me. Just before this call today, I was talking with Denise about a call I received about 10 minutes prior to setting up for this conference. I have one of my mom's sisters has Alzheimer's, and I received a message today that just a moment ago that she passed. It was expected. She led a long and very prosperous life. But we are, as a family, very dedicated to taking care of one another. So the statement that Ms. Carter made about being a caregiver, having been a caregiver, or those who might need care and services later on, really resonates with me, particularly as it relates to family members. I've helped my wife with caregiving, with her grandfather, with her mother who has, and it's a tremendous task. It requires a great deal of thought. It requires that we come together as a community, as families, as individuals who care for one another. So what I hope to impart today by way of information in this presentation will hopefully guide you in your journey toward caregiving. Next slide, please. I'm going to start off by talking about the prevalence and basics of caregiving. Currently in the United States, and this information is a little dated, but currently in the United States, there are about 40 million individuals, constituting about almost 17% of our population, who are caring for adults in their homes or while they are in facilities. In New Mexico specifically, where caregiving is a major part of the culture here, we have approximately 270 New Mexicans who are providing care. Now, the care that they're providing, some are doing so because it is a part of who they are, a part of the process of being alive and transitioning through life in New Mexico. Others have been forced into the role as caregivers. Regardless of what brings you to that role, we want to make sure that you understand that we're here to support your needs. As it relates to caregivers in New Mexico, it's estimated that about 43.5 million adults here in the United States are providing unpaid care services, and it averages about 12 months of time in which they are providing those services. Simply put, this means that individuals are providing these care and services that in a lot of cases requires out-of-pocket expenditures, separation from family, a myriad of different issues that affect their well-being as well. So think about that for a moment. $43.5 million is delivered in unpaid services by caregivers here in the United States on an annual basis. The majority of those caregivers are female. That to me does not come as a surprise because from a societal standpoint, women have been the backbone of our existence. We see that the trend for men has really increased in that men are today more engaged in the provision of care and services than they have been in the past. For us men, it is a learning curve. It's a serious curve. But we are, as men, committed to making sure that we are there with you as women, taking on that tremendous role as a caregiver. We're there to support and in a lot of cases be the primary caregiver. Of the caregivers that I have identified, about 8 in 10 of those individuals are caring for one person. Now, that doesn't mean that an individual doesn't care for more than one person at a time, because realistically, that's not the case. Oftentimes we find that in family situations, individuals are caring for a mother or father, or in a lot of cases, adults are caring for their grandparents. So the average in the country is that 8 out of 10 are caring for one person, and usually that person is a spouse or a mother or father. This information is very helpful in understanding what the impact is in terms of the prevalence of caregiving needs in our society. Next slide, please. Let's talk now a little bit about some of the realities of caregiving, because caregiving is not a simple process by no means. It's one that is very deliberate. It's one that is ever changing. It is one that is now what we call the new norm. The new norm in the sense that, as the first slide indicated, at one point or another, we will be either a provider of care or a recipient of care. And there are various stages that we need to be mindful of. And in this presentation, hopefully when you walk away from this call today, you will have tools to better understand the dynamics of caregiving. One of the problems that we face that is a reality is that there is a true avoidance of talking about caregiving. It is only recent that we saw that industry and commerce has really focused a little bit of attention on the need for caregiving resources. So we're seeing now resources becoming available. We're seeing long-term care insurance, but the reality is still that people don't want to talk about when there becomes a time for them to have care delivered to them. So because of that, and because of the way that we are as a society being very youth-oriented, we avoid having those serious conversations. But we really, truly need to stop and give time and attention and dedicate resources to doing so. In most cases, we're unprepared for the challenges involved in being a caregiver. We find simply that individuals have been for years and as a major part of their lives focused on their own needs. And now we find that as the responsibilities shift, those individuals don't truly understand all the aspects of caregiving. They don't have the tools necessary to meet the challenges presented as being a caregiver. And importantly, they don't know that resources are available. That statement is one that I vacillate behind. On one hand, I find that there are limitations as relates to the availability of resources, but also I find that there are a plethora of resources that are available that individuals, for one reason or another, be it a lack of knowledge or a lack of engagement, they're not taking advantage of resources. Again, through this presentation today, we hope to raise your awareness around resources and hope that you're able to utilize those resources to be the best caregiver possible. Next slide, please. Let's talk now a little bit about difficulties of caregiving. In the arena of caregiving, be it the professional caregiver or the individuals who are providing caregiving in a family setting, a family caregiver. Those tasks that they are asked to complete are far more difficult than those faced by individuals a generation ago. We're finding that coupled with the multiple and very complicated tasks that they're asked to undertake, there are limited training and support opportunities available to our caregivers today. We need to make sure that individuals are knowledgeable as to the ramifications of failing to meet the basic needs or the complex needs of individuals who are entrusted with their care. We need to make sure that our caregivers are equipped with the proper tools and resources that will allow for them to do the job to the best of their capacity. That we're focusing on the fact that individuals very quickly burn out from undertaking these caregiving roles, and we need to provide support for those individuals. The challenges that are presented to our caregivers are coupled with family obligations. Individuals are asked to do a multitude of different things in addition to taking on the role as a caregiver. Who among us has not been charged with doing our regular work job when we're working in the workforce? And before we go to work, get up and to go and to check on mom or dad. At lunchtime, we want to make sure that they're taking their meds. We want to make sure they're nutritionally balanced. So those are obligations that don't end at 5 o'clock, where individuals who are in the normal workforce, they can come home and have a little cocktail or spend time with family members, their children or whatever, or participate in other events or obligations. Those things are changing in the sense that there are added responsibilities as a caregiver that must be attended to. We're finding equally that our workforce is changing. The way that individuals are caregiving is causing tremendous stress in the workplace. Individuals are finding that there are difficulties in terms of trying to advance professionally. They're finding that because of the need to take time off, they are not in line with promotion opportunities. They're not making the types of monies that they formerly made because they're working less hours. So we're seeing there is a tremendous flight from the workforce as a result of individuals taking on the role as caregivers. And unfortunately, a lot of that burden is being borne by females. So we're seeing that there is a tremendous decrease in the number of women in our workforce, and opportunities for them to advance professionally are shrinking on a daily, a weekly, a monthly basis. We need to be in tune with that. We need to provide for policies in our legislative processes that allow for provisions of opportunities for individuals to take time out without being penalized for doing so. We need also to be mindful of emotional demands that are coupled with the process of providing care and services. Taking care of an individual who is decompensating, be it a mother, a father, or a grandparent, takes an emotional toll on individuals. It also has a toll that is to be paid as it relates to relationships. We're seeing a drastic increase in the number of divorces and domestic violence as a result of individuals taking on caregiving roles. They are splitting their times, and a lot of cases we're finding that individuals are not adjusting well, and it's having a very adverse impact on family relationships, and the emotional toll is something that we need to be mindful of. Also, we need to look at what is happening in terms of our living arrangements. We're finding at AARP that individuals are desirous of staying in their own homes, staying in their own communities, and we're doing all that we can to ensure that these opportunities are presented to individuals. But we're faced with challenges as it relates to housing. We have very antiquated housing codes that don't allow for cohabitation or home sharing or models of housing that would be conducive for individuals to stay in a community type environment. We're finding also that there's tremendous impact that is realized in terms of individuals who do choose to stay in their own homes as it relates to the escalating costs of home repairs or living in an environment where the structure, the integrity of a home is compromised, or individuals who may have lived in a two-story dwelling, no longer can they negotiate steps. So we need to be very mindful of opportunities and options that are afforded to individuals who are recipients of care and for those that we're caring for. Next slide, please. Some key focuses that I want to pay some attention to is very important in terms of how we strategize about our role as caregivers. What are we going to do once we undertake this responsibility? And again, it is a tremendous responsibility. We need to start with doing assessments of ourselves, but equally important assessments of those who will be the recipients of care. All too often in this process specifically, we find that attention is not given to making sure that when we're doing our assessments, we're including the care recipient in that process. All too often, we find that individuals make decisions about the well-being or what is perceived to be well-being of individuals that we're entrusted to care for. We need to make sure that those assessments includes feedback where possible from the individual, again, who is a recipient of care. We need to be mindful of how we go about developing our teams, making sure that we have the broadest approach possible of individuals who will augment our team to make our work successful. We need to make sure that there are individuals from a family perspective, from a professional's perspective, and we will talk a little bit about those two categories as we advance through this presentation. I broached earlier the need for training. We are working and we're finding that training opportunities are becoming a little more available to individuals who are desirous of enhancing their skill sets, either out of desire to be better at the work that they're charged with, or because it is a safety issue. When we're caring for individuals, we are subject to tremendous injuries, and data has shown that a lot of cases, particularly as we're dealing with dementia-related disorders, that the individual who is the recipient of care is in a lot better physical shape than the individual who is providing the care. So we need to be mindful of training opportunities and make sure that training is available so that the caregiver is not in a situation where they are injured or they are incapacitated to the point that they can no longer be of service to that individual. We need to prepare for situations such as social isolation. As we look at the aging process, we find that individuals are, as again, I broached earlier the fact that we're a very youth-oriented society. So in that society, individuals who are advanced in the aging process were often relegated to lesser roles. As a result of that process, we find that individuals suffer from tremendous loneliness and social isolation. We need to do all that we can to ensure that individuals continue to engage from a social, from a political, from a pleasure standpoint in activities that they are allowed and capable of engaging in. We need to be mindful of individuals, and my work as outreach coordinator for the state AARP programs deals with issue that is very serious in the minds of caregivers, and that individuals who are care recipients are oftentimes, as a part of social isolation, more prone to be subject to fraud, scams, and identity theft. So when we're talking about protection of individuals' identification, we need to be providing training. We need to be aware of how individuals interface with callers. We need to safeguard the best we can pertinent information about their social security numbers, accounts that they may have. So how do we protect those resources? Today, we'll talk a little bit about how we can make that possible. Special populations is something that is near and dear to the Alzheimer's Association and also to AARP. As it relates to dementia, Alzheimer's, and related disorders, they're very special and delineated needs for that population. It same holds true for individuals with Parkinson's, individuals who are debilitated in terms of ambulation, individuals who have special dietary needs. So there are special population that training also comes into play, and that we need to be mindful of those special populations. Next slide, please. Next, I'd like to talk a little bit about today's caregiver, because they are vastly different from the caregivers of yesteryear. In olden days, as I hear individuals sometimes refer, caregiving was a very simplistic process. Individuals stayed in the home where care was needed. Individuals were there to take care of them. In today's society, we're dealing with a myriad of different issues, such as juggling of a job and caregiving, care being a very lengthy process, in some cases lasting 4 years or more. Oftentimes, there are children living in the home of the caregiver, and we have to shuffle kids from here to there. We have to care for the needs of the elderly, so that makes it difficult for a caregiver. We're also asking caregivers to undertake very complicated medical tasks, and I'll talk about each and every one of those categories as we go to the next slide. Next slide, please. I talked a little bit earlier about employment opportunities. When we do speak of employment opportunities, we talk about hardships that are encountered by individuals as caregivers and care recipients. Most of the individuals who we're entrusted to care for are on very fixed incomes. So when unexpected billing comes, when, say, for instance, individual is doing unnecessary testing, that is an unexpected expense that is borne by the recipient of care. And oftentimes, what it equates to is that the caregiver absorbs the cost of those unexpected expenditures. That creates an environment in which it puts stress on the caregiver's family. It causes a diversion of their resources. And then oftentimes, it's identified as a cause by which individuals are deferring retirement. They're not retiring anymore, or because we have a society in which New Mexico leads the country in grandparents who are providing care to their grandchildren. These are tremendous responsibilities that we're faced with. So individuals are leaving the workforce as a result of the responsibility of caring for loved ones, be it the very young, where an individual may be subject to addictions, or military service where they're deployed elsewhere and the grandparent has to step in. These things will ultimately affect the income of that caregiver and create a situation where there are financial hardships. The women are leaving the workforce in tremendous numbers, and we need to be mindful of that. Care and technology. There are a variety of different new tools that are available in the marketplace. Caregiving apps, monitoring apps, just a myriad of different resources that we need to make sure are available to our caregivers. there are a variety of different care options, from delivering care in a long-term care facility or in a home setting. When we're caring for an individual in a home setting, are we doing those things from a precautionary measure to make sure that the house is safe? AARP has answers to those questions. We've got a home fit guide that allows for individuals to look at their homes, to be able to retrofit those homes to meet the needs of the individuals who are occupying those dwellings. So there are a variety of different care options that are available. And should you be interested, that publication is called Home Fit. And I am available, and I have my information at the very end of this presentation. If you're interested in those publications, let me know and I'll see that we get those to you. I talked about children in the home. Well, COVID-19 has thrown us a tremendous curve, you know. Previous to the onset of the pandemic, we were seeing that individuals were faced with what is called the sandwich generation. That's where an individual as a caregiver is caring for their parent, and they're also caring for their children in the home setting. The reality now is simply this, that we have what is deemed to be a club sandwich because of what I talked about early of grandparents raising grandchildren. We're seeing that there's an explosion of populations that are in the households now. So it may be 3, 4 generations where you've got a grandparent, you got the caregiver, you've got the caregiver's children, and you got grandchildren there. So we need to make sure that we're providing resources that allow individuals to cope with these situations. Home versus school-based learning. Caregivers are now being required to take on the role as teachers. We're finding that in the course of a day's activity, a caregiver is getting up, as I said, in the morning, they're attending to their parent or a grandparent, as well as a child. They used to be able to see that child off to school. Now they're turning on their computers, and those kids are having homeschooling right there in the house. And unquestionably, this puts weight on that responsible caregiver. So we need to be mindful of that, be aware of the stressors that are created as a result of this pandemic, and to be helpful and supportive of our caregivers as a result of their added roles. When we talk about complicated medical tasks, I spent 26 years regulating healthcare for federal and state government. I worked for New Mexico, well, for New Mexico, it was a licensing and certification bureau, and I worked for Healthcare Finance and Administration, which is currently the Center for Medicare and Medicaid Services. I was a health facility surveyor, and back when I was doing my work as a health facility surveyor, there were certain restrictions on what an individual could do in a healthcare setting, institution. Now we're seeing that those restrictions are being lifted, and caregivers that are unskilled, untrained, are being asked to participate in very complicated medical medication management, infusion therapy. They're also asked to provide wound care and services. We need to seriously focus on how are we preparing these individuals to take on these new roles that are full of risk and anxiety based upon these newfound responsibilities and lack of resources. Next slide, please. Major caregiving tasks, ADLs, activities of daily living, as well as instrumental activities of daily living. Activities of daily living, eating, bathing, ambulation. Instrumental is grocery shopping, picking up medications. These are tasks that are being undertaken by our caregivers. Specialized care, as I just talked, I won't elaborate on that, but caregivers are asked to engage in those activities. Medication management. We're also asked to be legal representatives of those care recipients. There are complications in terms of individuals who are taking on these roles. They, in a lot of cases, are denied access to medical documents or the delivery of services. So we have to advocate for individuals to be able to take on that role and to not suffer the roadblocks that are presented when an individual does not have authorization to receive information as part of being a caregiver. I will again talk more detail about that later on. Financial management, that kind of goes without a great deal of talking about. We're asked to not only take care of the responsibilities as it relates to our families, but also managing the finances for our loved ones. Next slide, please. When we talk about caregiving, there is a variety of different means by which caregiving is delivered, and populations of individuals who are recipients of that care services. Particularly, I'm a veteran. I am a veteran of the U.S. Air Force, and I work very closely with veteran organizations to make sure that care and resources are provided to not only the veterans as well as our current military members, but also family members of those who have served honorably in our military service branches. So that is one special population that we need to be mindful of. I will be having a veterans-based teletown hall on next Tuesday, the 10th, that speaks to issues relating to our veterans population and specialized care and needs and services that they are entitled to. I talked a little bit about fraud and scam prevention. AARP has a plethora of resources that addresses fraud, scam, and identity theft. Please, if this is something of interest to you, reach out to AARP, let us know of your need, and we'll try to provide resources to meet those needs. AARP is also very active in what is called livable as well as age-friendly communities. In those arenas, we deal with things such as access to medical treatment, proper housing, transportation, engagement in social and civic activities. So when we're providing specialized care, it is very helpful for individuals to understand the existence of resources and to be able to tap into those to, again, make the quality of life better for those we're caring for. The pandemic, you know, we're just so saturated with this pandemic now. And just when we thought we were, in fact, rounding the curve there, we're now besieged with an increase of cases. So I'm not going to belabor that point, but there are provisions of care that are specific to the needs, such as PPEs, such as making sure individuals, when they're seeking services, are taking protective measures where it deals with encounters that they may be involved with healthcare professionals or individuals in their ordinary path of activities. I talked again about social isolation earlier, and I won't belabor that point also. Next slide, if you would please, Denise. Here we go now with the body of the discussion that I wanted to talk about. However, it was important for me to set the stage. We're going to now go into the finite points of providing care and making sure that there are some tools that are available to us at AARP that we can share with you that hopefully will help make life easier for you. Next slide, please. I'm going to first talk about some tips to finding services and supports that are available to caregivers. All too often, pride intervenes, and we as humans are less likely than we should be to ask questions or to be so proud as to ask for help. We need to put that to the side, and we need to ask for help when help is needed. We need to make sure that individuals understand that there are support groups for a variety of different ailments, conditions, rehab situations that they may be involved with. So we want to make sure that we can help you provide those care and services and provide access to support groups. If possible, we encourage individuals to use the internet. The internet is a wonderful tool that allows individuals to do research on issues that are of importance to them, as it relates to caregiving, as well as other matters important in their lives. We recognize that not everyone has access to internet, so we do have, again, a cadre of resources that are in print format at AARP, and I will certainly help share that information with you if you have a specific question about those resources. I have a question for you. It's a rhetorical question. How many times have you personally gone to your doctor and prior to presenting to that healthcare professional, you sit and you think, oh man, I want to talk to my doctor about this. I want to talk to my doctor about that. And then you get in front of that healthcare professional and it all evaporates. You don't remember anything about what you wanted to talk to that doctor about. We want to make sure that you are aware that it is helpful, very, very helpful, if you jot down questions that you may have of your healthcare professional in advance of presenting. And then you're in a better position to ask those questions and receive the answers, or to receive guidance to individuals who will be helpful in getting answers to your questions. Just as you're participating in this conference today, I encourage you strongly to identify where opportunities exist for you to gain knowledge and insight about things that you're dealing with in your caregiving life. And those things can typically be found through attendance, either virtually, which is our reality of today, or once we're able to, going back to conferences and workshops. And lastly, as it relates to these services and resources, subscribe to publications. There are a tremendous amount of resources that can be found in publications. AARP has a website, aarp.org. Let me repeat that, aarp.org/caregiving. And when you get there, you can find a drop down there or a site for toolkit. Subscribe to AARP. If you're not a member now, you don't have to be a member. You can go to that site and get information, as well as I said, other publications that are available. Next slide, please. Now I'm going to talk about 5 important steps to a caregiving plan. You'll see I highlighted there, that's a picture of our Prepare to Care booklet. This is a resource guide for individuals who are taking on the role of caregiving. Within the content of that booklet, that publication, you'll find discussions around how do you start a conversation? What do you do to form your team? How do you make a plan? How do you identify and utilize resources? How importantly, do you care for yourself? So I'm going to now walk through each of those 5 steps and provide some insight that, again, I hope you find helpful. Next slide. Here's a saying that I came across when I was putting together a presentation early in my stint with AARP. It reads simply, every time I try to bring up the future, my dad just shuts down. He tells me the important papers are in the cabinet, but the conversation never seems to go beyond that. That's something that we're faced with. I talked earlier about having conversations and how we are reluctant to do so. This is a reality, and we need to learn strategies that will allow for us to successfully engage individuals in conversations and get them to better understand that the work that we want to do is for their betterment. Next slide, please. Starting a conversation. What we need to be mindful is looking at an opening. I have known of, and I have seen individuals as a result of us doing conferences where they talk about, well, I tried to start a conversation and we were having dinner, or the individual was in a bad mood and didn't want to talk about it. We need to make sure that the opportunity is optimal for having a conversation about caregiving because individuals from one standpoint are very proud. They don't want to accept care. But the reality is there's a lot of cases those individuals need our intervention, and they need us to provide those care and services. So look for the opportunity that is most conducive for an individual to engage. not early in the morning unless that individual operates best in the morning, not late at night unless that individual is a late riser and is more operable later in the evening. But you need to identify when the best opportunity is to start a conversation. Understand who is the best person to start that conversation. It may be that a son or a daughter is not the ideal person to talk to a loved one about care and how they are to receive those services. It may be better suited that a relative, another relative, a sister, a brother, or aunt or uncle may be better suited to open that dialogue. So understand who the best person is to start a conversation around caregiving. How does a family respond to uncomfortable subjects? That's very important to understand in terms of identifying best strategies for approaching the conversation. What are the concerns and what are the priorities? Looking also at the importance of talking with the recipient of care. Understand what their biggest concerns are. Understand what their priorities are around the caregiving process. An individual may be focused on having opportunity to go to an appointment to get their hair done, or it may be to go shopping. It's a great deal of opportunities to talk about concerns and priorities. Take time, understand through dialogue what concerns and priorities exist. Next slide, please. Tips to begin the conversation: include the care recipient, respect the wishes of the care recipient. If they say, I don't want to talk about this anymore, honor that wish. Find another time to revisit the discussion. Have respect for your siblings who may be also taking on the caregiver role. They may not be as well equipped as you are to take on the role as a caregiver. Respect their wishes to engage or to not engage. Clarify for all the caregivers as well as the care recipient, what are the issues around caregiving? How are we going to address this? This goes into the planning process. Show importantly what your concerns are for that individual, why you want to intervene, why it's important for their safety and well-being that you want to take on the role as their caregiver. Recognize also your limitations. There are a great deal of times when the care that is needed is beyond our capabilities. It is important for a caregiver to recognize where their limitations are. You may not be an individual equipped with financial skills necessary to handle the responsibilities of budgetary concerns. Find that there's an individual that is equipped with those skills and take advantage of that. Next slide, please. Overcome resistance. Oftentimes, as I said, individuals don't want care or they don't feel it's necessary to care, to have a caregiver. We have to consider the circumstances and where individuals have care needs that place them in jeopardy from a safety standpoint. Sometimes we need to be more direct. We can start off by saying in our conversation, well, have you ever considered that these steps in your home may not be the best thing for you to emulate, or the rugs that you have on your floor constitute a slipping hazard. So sometimes you can approach that very delicately. Other cases, you have to push the issues and be more direct, particularly in cases where it concerns their safety. Where you're meeting with difficulties and communicating with individuals, bring in professionals, bring in a doctor that may be able to talk with an elder. It's proven that, particularly from a generational standpoint, our elders are more likely to take information and to take advice from healthcare professionals and particularly doctors. Members of the faith-based community are a great resource for individuals who are meeting with resistance from family members, loved ones. Trusted friends who may have gone through processes, had experiences with caregiving themselves or with a family member. Oftentimes they will help break down that barrier that's created when an individual is resisting care. Next slide, please. Step 2, form your team. When you're looking at forming a team, list everyone that's possible. Anyone who can contribute to the caregiving process, put them down on your list as a potential resource for yourself. Invite them to engage, ask them for suggestions and ideas. We must also include those difficult family members. Those are the individuals who, for whatever reason, may not want to care or may not be equipped to care emotionally, but we need to make sure that we extend to them an invitation to be a part of our team. We need to also designate a family team leader, an individual who will keep you on task, who will make assignments of duties and responsibilities. You know, oftentimes individuals will just talk about, well, I need to do this or we need to do that. Make a list. Have a team member who's leading that conversation and holds individuals to task. Next slide, please. Dealing with conflicts, understand that dormant tensions may exist between family members. There's a tremendous amount of stress created among caregivers. Recognize that and deal with it accordingly. Recognize that, again, anywhere from 12 months to 4 years expected time frame for caregiving, and deal with emotional declines, the emotions associated with declines and diagnoses that may not be in the best for interest for the individual who you're caring for. Next slide, please. Step 3 in our plan. We really want to, if you advance to the next slide, please. We really want to think about the structure of our meetings when we're organizing our team. It's advisable that the first meeting that you have, and where feasible, make that an in-person meeting. And if we're still in the throes of this pandemic, conference calls or any of the other available platforms that you can convene individuals that are part of your team, that is important, that you have a face-to-face so that you can meet and talk with individuals. You can deal with emotions. You can discern from facial expression where individual may have a concern. That is advisable. For future meetings, you can do those in email format, making sure that you stay connected on a regular basis. Again, I'm going to reiterate, involve that person who is receiving care and treatment. Take your notes, making sure that if an individual is assigned a specific task or role, that you can refer back to your notes, and that will be largely the part of your team leader to hold people to task. And that note-taking process is a great tool to do so. Make sure that you're summarizing next steps, making sure also that you understand that sometimes changes occur. An individual will decompensate, an individual will get better, and hopefully that's the case. But you need to make sure that you're summarizing, where do you go from here? What are our next steps? What resources do we need called to bear? Next slide, please. In your plan, make sure that your plan's not real long, not really delineated. Doesn't have to be a fancy plan, just something that everyone can understand and that you share it broadly with those members within your team. It shouldn't be too formal. It should be in simple lay terms. If there are technical aspects of it, make sure there's training provided so that individuals are familiarized with what's being asked of them. Make sure it covers all areas as it relates to the care to be delivered. And by all means, look at our AARP Prepare to Care booklet. That again can be found at www.aarp.org/care. That booklet you'll find is chock full of resources that will be very helpful for you. Next slide, please. Recognize that plans are great, but there are great opportunities for change to occur. Be pliable to that and recognize that one of the most important parts of care planning is having the conversation. So be prepared for change, be pliable, and make sure that individuals recognize the care recipient, that you're changing course, that this is what we're going to try to accomplish now through the provision of this care. Next slide, please. Find your support. That's a very important role that caregivers need to be mindful of. Would you, Denise, advance to the next slide, please? Some of the types of support that you need to be mindful of and also tap into are located within your own community. When we were able, we used to be able to get out freely and go to health fairs. We would go to conferences and conventions. We could visit establishments that are providers of care and services and gather information. We can understand better what city services are provided or other professional services that may be available that you can tap into. So locate those resources, look at resource directories, call upon aging and long-term services. The Aging and Disability Resource Center is a great tool for you. Consult with professionals who have the knowledge, the skill, and the tactics for providing care and services. And when you deem necessary, don't be afraid to reach out for professional help. Hire that help, look for resources that provide a funding stream for the delivery of those services, and please tap into those services. Next slide, please. Care for yourself is our final step. Denise, advance that slide, please. Here's some information, and briefly, there's a number 877-333-5885 that AARP provides for individuals to call for caregiver support. The number for Spanish speakers is 888-971-2013, again, for Spanish speakers. Plethora of resources available to individuals, and I hope that you're able to tap into that. Next slide. Caring for yourself. Distance caregiving is a reality. Utilize professionals, explore technology that's available. Work with your employer where you find there are conflicts in your work schedule. Use FMLA where necessary. Utilize those resources. Understand the financial impact on personal finances, reduced hours, passing up promotions as I spoke to before, recognizing emotions. Not everyone is in this by choice. Some need to adjust to the process of being a caregiver. Take care of yourself. Allow for breaks without guilt. Exercise, sleep. Engage in healthy eating. Reduce your stress in ways that are fun and engaging. Caring services and support. Share your resources. Share your experiences, strategies, and broaden your circle of caregiving resources. Next slide. Important legislation was taken on by Representatives Tomas Salazar and Deborah Armstrong, and that was the introduction and passage of House Bill 139, which is the Caregiver Advice Record and Enable Act. The CARE Act is designed to make sure that individuals, because of HIPAA rules, the rules that prohibit individuals from sharing information, now through the House Bill 139, it is possible that a caregiver, a family caregiver, can become a designee in the caregiving process when individuals are presenting only to acute hospital environments. This is applicable only to acute environment. So individuals can be designated as a caregiver and can be privy to information that the caregiver receives. It also requires that the caregiver be informed of discharge or transfer of the individuals from that acute care facility. It provides caregiver explanation of treatment and also requires demonstration of processes or procedures before discharge or transfer of the patient. Next slide, please. A parting thought, but no matter how they may feel, how they may make you feel, you should always watch elders carefully. They were you and you will be them. You carry the seeds of your old age in you at this very moment, and they hear the echoes of their childhood each time they see you. This was written by Kent Newburn in a letter to my son. I found this very profound, and I hope you do as well. Next slide, please. My contact information is here. I can be reached at 505-946-3601. My email address is gdwilliams@aarp.org. So if you call that number 946-3601, I can share the email address with you at that time. I'm sorry, I didn't include that in that slide. Next slide, please. I want to thank you for your attention to my presentation today. I indeed hope that this information has been helpful, and I apply myself to the task of helping you further in your journey as a caregiver. Thank you very much. I'll open it up for any questions you may have now.
So if there's any questions that anybody has, you're welcome to type them into the chat room. Also, if you're joining us on the meeting, the Zoom link, you can also put any questions to Mr. Williams in the chat room here as well. So right now, Mr. Williams, we don't have any questions. The guide that Gary spoke about in his session, if you are looking at the speaker page or the presentation page, you'll have tabs that have chat, polls, people, and files. If you click on that files link, he has some information. I want to go ahead and just briefly share his infographic since we have a few minutes and there seem to be no questions right now. But he does have some an infographic for New Mexico, as well as that Prepare to Care guide that's available for you to download and save to your computer. You can print it out, whatever you need. There is also in our exhibit hall, there's also an AARP exhibit booth with tons of different resources that Gary mentioned in his presentation.
Again, I would like to thank Denise for the stellar job that she's done in preparing me for this call, and also being, again, the technician to make it technically possible. Thank you, Denise.
Of course. So if there's no questions, then we'll go ahead and end the session. Thank you, Gary Williams from AARP. And
Denise, can I provide, because again, I was remiss in putting that, my email address, because a lot of people prefer that. My
sure,
email address is gdwilliams@aarp.org. And I welcome your comments, suggestions, and to be a resource for you. Thank you again, Denise.
Great. I went ahead and also put that in the chat room, so that'll be available there as well.
Thank you,
and that was, again, gdwilliams@aarp.org.
That is correct.
Okay, great. Thank you again, Mr. Williams. And thank you to AARP. Yes.
Good luck, caregivers.
Thank you.
Thank you.
Thank you all for joining us today. We'll go ahead and end our meeting. If there are any questions that you had and weren't able to ask them during this session, feel free to visit the exhibitors booth and they can answer any questions, anything that you might need. Also, you can go to aarp.org. There's tons of resources at their website. Thank you, everybody, for joining us.